Welcome. Thank you for choosing Tallahassee Orthopedic Clinic. We look forward to helping you return to a more active lifestyle. Tallahassee Orthopedic Clinic provides comprehensive preoperative and postoperative rehabilitation services for patients undergoing total joint replacement. In this video, you will find important instructions and information to help prepare you for surgery and discuss things you need to do before, during, and after your surgery. After watching this video, please take the time to read the educational packet provided to you by your physician carefully. Our goal is to make your recovery and rehabilitation as easy and productive as possible. We are committed to keeping you informed, and we will do everything we can to make your time with us as pleasant as possible.
Preparing for your joint replacement surgery begins several weeks before your surgery at your preoperative appointment. At your preoperative appointment, you will meet with your surgeon and/or a member of our healthcare team to schedule the surgery date and to discuss the plan of care that best suits you. In this appointment, you will also discuss your health history and any medications you are currently taking. Prior to surgery, you are required to obtain medical clearance from your primary care physician before undergoing total joint replacement surgery. You will also obtain a physical therapy evaluation. Physical therapy is a key component to your recovery. Your surgeon may recommend a physical therapist who will complete an assessment and develop an exercise program designed personally for you. In the weeks before surgery, you will be asked to maintain a healthy diet, stop smoking, monitor your blood sugar, eliminate certain medications, have a dental examination, and begin your home exercise program under your physician's instruction.
You will also need to complete a total joint education class and prehab appointment prior to your preoperative appointment.
To ensure you're prepared for your total joint replacement, please refer to the surgery preparation checklist. Important things to remember to bring to the hospital include comfortable, loose-fitting clothing, supportive slip-on shoes with non-skid soles, toiletries, a list of your medications, and an emergency contact list. The day of your surgery is a busy day. You will begin your day at a pre-admission testing appointment. Here you will meet the nurse who will coordinate your preoperative care, and collectively you will review all of your paperwork, draw lab work, and perform preoperative teaching. Next, you will be sent to the preoperation holding area. This is the area you will be in immediately before you are taken to surgery. While you are here, you will meet with the anesthesiologist and surgical nurse to discuss your surgery. Have an IV started to give you fluids and antibiotics. Have your surgical site marked by your surgeon and prepare for surgery. When it is time for your surgery, you will be taken to the operating room where you'll be cared for by the anesthesiology team and your orthopedic team. While under the care of your orthopedic team, we will take every possible measure to ensure your safety and maintain your modesty. The length of your surgery will depend upon the complexity of the procedure, but the normal time for a replacement surgery is between 2 to 4 hours. After your surgery, you will be taken to the post-anesthesia care unit, where the anesthesia team will slowly awaken you and monitor your blood pressure, pulse, respiratory rate, and heart rate. Once you are ready to leave the recovery room, you will be transported to your hospital room where your family and friends can join you.
Joint replacement surgery is designed to reduce the pain that you are currently experiencing. It is common to experience some pain following surgery as your incision heals and you get used to your new joint. Our medical staff will do everything possible to ease your discomfort. Although not all pain can be eliminated, pain relief medication can safely lessen the pain you feel after surgery. Once your pain is controlled, you will be encouraged to get out of bed. Getting up and moving is the most important part of your recovery, the most effective way to decrease your risk of developing a complication after surgery, and the key to decreasing your overall pain. Your nursing and therapy staff will work together to get you moving as soon as possible.
Following your return home, physical therapy will be critical to your recovery from the joint replacement procedure. A physical therapist will begin working with you the day of surgery to gradually increase your activity. You will begin physical therapy as soon as you are awake and continue 2 to 3 times a day. Expect to feel tired, but remember that activity is vital to your recovery.
Outpatient surgery patients will be sent home the day of surgery. Your surgeon will check in on your progress, and your postoperative nurse will monitor your IV site and instruct you in deep breathing exercises. You will receive gait training with a walker and will be instructed concerning getting in and out of the car, going safely up and down stairs, and moving safely around your home or work. Rehabilitation is an important step that will help guide you to meeting your goal of returning to normal functional activities. Total joint replacement patients will often require physical therapy. These physical therapy sessions may be necessary up to 3 times a week for 4 to 6 weeks following your discharge from the surgery center. We will choose a physical therapy location that is approved by the patient's insurance company and conveniently located. Patients can usually drive themselves in about 4 weeks. Goals of physical therapy include minimizing swelling, increasing your range of motion, and building strength and independence in the home physical therapy program provided by your physical therapist.
Your home exercise program is designed to increase strength, range of motion, and decrease your blood clot risk after joint surgery. Continued motion is imperative to your recovery. Here, we're going to review your home exercise program and its proper execution. Our physical therapists suggest 3 sets of 10 reps of exercises completed 2 to 3 times throughout the day. To prepare for ankle pumps, find a comfortable position sitting or lying. Pump your ankle up and down like so. Repeat 10 ankle pumps in 3 sets. Make sure to rest in between sets. For ankle circles, first, sit in a chair with good posture as shown. Trace clockwise and counterclockwise circles with your big toe. Repeat 10 ankle circles in 3 sets. Make sure to rest in between sets. To complete heel slides, first lie back on your bed with your knee straight, keeping the heel in contact with the bed. Slowly slide your heel up towards the buttocks. Relax back to the start position. Repeat 10 heel slides in 3 sets. Make sure to rest in between sets. To prepare for a standing hip abduction, stand and hold the back of a chair or kitchen counter. While holding the back of a chair or kitchen counter, raise your operative leg to the side. Make sure your toe is pointed. Relax your leg back to the starting position. Repeat 10 standing hip abductions in 3 sets. Make sure to rest in between sets. For gluteal sets, lie back on your bed with your knees straight. Tighten your buttocks. Keep your knees straight. Relax and begin again. Repeat 10 gluteal sets in 3 sets. Make sure to rest in between sets.
Specific precautions regarding limitations or restrictions in hip or leg positioning will be discussed and reviewed by your surgeon. Bed mobility. To get out of bed, scoot to the side of the bed using your non-operative leg. Position your hands behind you and push up as you angle your body around and scoot your hips and legs forward to the edge of the bed. If you have hip precautions, remember to keep your legs apart, toes up, and upper body semi-reclined. Reverse this process to get into bed. Standing and walking with a walker. To get out of a chair, begin by scooting to the edge of the chair. While keeping your operated leg extended out in front of you, push up using the armrests and the non-operated leg for support. If you have hip precautions, remember not to bend your torso too far forward. Reverse this process to sit down, reaching back for armrests and slowly lowering yourself. No plopping. When walking with a walker, first advance the walker, then step forward with your operated leg, then step forward with your other leg, supporting some of your weight with your arms on the walker as needed. Remember to stand up straight. Don't lean over your walker. Take even strides with a heel-to-toe walking pattern. Tub and shower transfers. Be careful when entering the shower. If you have a tub, using a tub bench is the easiest and safest way to get in and out. Sit down on the tub bench with your back facing the tub. Pivot around, lifting your legs one at a time over the side of the tub. If you have hip precautions, remember to keep your body leaning backwards. Reverse this process to get out of the tub. If you have a stall shower, enter and exit using a side step technique. A shower chair may be useful to enable you to sit and wash up while you are in the shower. Rubber bath mats and wall-mounted grab bars are also helpful for stability. Stairs. Remember, up with the non-operative leg, down with the operative leg. When going upstairs, lead with the non-operated leg, then follow with the operated leg. Take one step at a time and use railings if possible. If no rail is available, fold up the walker and use it on one side. When going downstairs, step down with the operative leg first and then follow with the non-operative leg, taking one step at a time. Curb step. When going up a curb step, approach with your walker and get as close as possible. Lift the walker and place it on top of the curb, making sure all 4 posts are secure. Step up with your non-operative leg, leaning forward onto the walker, then follow with your operative leg. When going down the curb step, simply reverse this process, stepping down with the operative leg first. Vehicle transfer. When getting into a car, park the car several feet away from the curb to allow a level surface entrance, if possible. Have the driver move the passenger seat as far back as it can go to maximize legroom, and recline the seat back about 30 degrees. Back up to the car, reach back for the seat, and gently sit, keeping your operated leg extended out in front of you. Scoot back and pivot to face forward in the seat, bringing one leg at a time into the car. If you have hip precautions, remember to keep your upper body reclined, your legs apart, and your toes pointed up.
Make an appointment to see your surgeon 10 to 14 days after your surgery. Eat well-balanced meals and drink plenty of liquids. Place ice packs over your incision to decrease swelling and pain. Call your surgeon if you experience a persistent temperature greater than 100.5 degrees, severe pain that is not relieved by medication, increased redness, swelling, or tenderness in your incision, persistent drainage from your incision, chest pain or shortness of breath. Do not drink alcohol or drive while taking pain medicine. Continue your exercises a minimum of 2 to 3 times a day, unless your surgeon tells you differently. Thank you for choosing Tallahassee Orthopedic Clinic for your total joint surgery. It is our mission to help patients live healthy lives through exceptional orthopedic services and compassionate care.